I'm going to give them 1 more minute to sign on, and then we will start. There we go. I think we will go ahead and get started now. I want to thank everyone for coming and joining us for our series that we're having on money, wealth, and health. And this is going to be talking about smart choice health insurance basics. And it really is learning about how to choose a health insurance plan. And this is important, especially now with the COVID-19, that some people have lost their health insurance, or so they're looking for plans on the marketplace, or also you may be getting ready to have open enrollment with your employer and be looking for health insurance plans. So tonight we're going to be learning some basic information to help you make a smart choice health insurance decision. And we will discuss important health insurance terms, cover the importance of having health insurance, and look at some things that you can do to choose a health insurance plan that will best meet your needs. The overall goal of this session really is to help you better understand how health insurance can really help you control healthcare costs, and especially those unwanted, unexpected expenses. We are recording this session, just a reminder, so that we know that, let everyone know that. We're going to take a few moments just to introduce ourselves. My name is Lisa McCoy, and I am an extension educator actually in the western part of Maryland. And I've been with the University of Maryland Extension for 6 years and have been with the Health Insurance Literacy Initiative team for 4 of those years.
My name is Carrie Sorensen. I'm also an extension educator. I mainly work in Frederick County, and I've been with Extension for almost 3 years now. We also have Jesse Ketterman with us today, so if you see his name in the list as a host, he is our tech extraordinaire. He's going to be managing some things in the chat for us. So if you can find a way to pull up the chat feature, you should see throughout the presentation as we go through everything today that he'll be putting links and information for you all in there. So watch out for that.
Okay. So thanks, Carrie. And speaking of links, actually, we're going to be putting our first link into the chat box. As we present some information today and give you some materials, we'd like to have you answer a few questions for us, both at the beginning and at the end of this session, just to see if the information that we're providing is actually meeting the needs of our audiences. So if you would just take a few moments now to open the link that Jesse has shared with us in the chat box and answer those few questions, very brief. And you can keep that open because you'll be going back to that at the end of the session as well. Please let us know if you have any problems getting that link. Just put in the chat box there. Okay, so I think we'll move forward now. So consumers say they are confused about making health insurance purchase decisions. And they also say that they're not confident about making a good choice. So tonight we wanted to just explore some basic information that you need to actually help you make a smart choice when you're making your health insurance decision. So the goals for our session this evening are to help you understand why health insurance helps to prevent large unexpected healthcare expenses, learn what you need to compare to understand cost and coverage, and also how to identify some basic information that you need to make a smart choice. Understanding this information will actually help you to become more confident when you make your health insurance plan choice. So to start off, we'd like to share an experience that was recently shared with us. Meet Jamie. Like many of us, Jamie is busy with the duties of daily life, managing work at home. Managing work at home. Jamie is single, healthy, and trying to make ends meet, so health insurance has not been a priority. Unfortunately, Jamie accidentally slipped, fell, and had to go to the emergency room. This fall was pretty bad, and so Jamie needed emergency surgery for a broken arm. This became a very stressful situation because Jamie was uninsured and had very limited savings. Jamie was preparing to move next month and had saved just enough money for the security deposit and the first month's rent. Like Jamie, each of us has fallen, slipped, or tripped. And most of the time we are lucky, but sometimes a fall, slip, or trip can result in a broken bone, or worse, and the cost of that injury can be surprising. This accident was something that Jamie hadn't planned for. However, Jamie recognized the real cost of not having health insurance when the bill arrived. So put in the chat box and tell us, how much do you think it cost for Jamie's broken arm? Anyone have any ideas of how much it might cost for that broken arm? 2,500, 12,000, 15,000, another 2,500. Oh. So those are all really good guesses. 5,000 I see from Shelley. Good. So sometimes it's hard to imagine, if you've never had that before, to really know how much do you think it would really cost us if we had a broken arm and go to the emergency room. So let's look at the actual cost for Jamie's broken arm. Here's how the expenses added up at the hospital. After the fall and arriving at the hospital, Jamie was admitted to the emergency room, had blood drawn, x-rays taken, and received pain medication for the surgery by the anesthesiologist. Finally, Jamie's arm was set and put in a soft cast by a doctor. So you can see the hospital costs there for the pharmacy and drugs was almost 2,400. The hospital supplies was over 2,000, and the emergency room visit was 3,000. Then the follow-up cost included a visit to the specialist for the hard cast and more x-rays. So it was 500 for the hard cast and 2 visits to the specialist for 200, and then the x-rays were a little over 1,000. So as you can see, the total cost without insurance was $9,351.96. And that was for a broken arm. Any surprises there? Anything you want to put in the chat that you're surprised about? Yeah, it is shocking, isn't it?
Yeah, Lisa, I want to second Shelley's comment. That was what I
Yeah.
thought when I
Yeah.
saw it for the first time.
And if you don't have a lot of savings, to get a bill like that could be really eye-opening for you. So this is just one example and only based on a single event, but the rates and charges can vary depending on where you live, where you get the services and what type of facility it is. But you can understand why Jamie wanted to consider getting health insurance after having this experience. Because without health insurance, he or she had to pay the full bill of almost $10,000 for that broken arm. I think that helps us to understand the importance of health insurance for sure. So Terry says it's more than what would have guessed, but not really surprised. Now, hopefully all of you did receive an email with the resources that we are going to refer to today in our webinar here. So hopefully you'll have access to those. So this is a comparison of cost of what it would cost with insurance and without insurance. So you can see without insurance, which is what we just shared with you, the cost of that broken arm. And then the other column actually just shares with you an example of a plan that someone could purchase from the health insurance marketplace, just to give you an example of how much the health insurance does help to offset some of those expenses. So this plan actually helps to reduce that financial burden for Jamie, and also you see the difference between, this is the health insurance plan, but it's very similar if you get a plan buy your health insurance through your employer. So when you have health insurance, the cost of care are offset, and you will be less, it will be less than without health insurance. So that decrease in cost can be seen regardless of whether it's a marketplace plan or a employer-based plan. Any questions on that? Any thoughts? So this is a bronze HMO plan that we're comparing it to. So you will notice in this that the plan is actually, we're assuming that this event occurred early in the year. So there was no other medical expenses that occurred before the accident. So you'll see where there is like a $4,000 deductible. So a lot of those expenses are going towards the deductible. And then the insurance would kick in after that $4,000 has been paid. So, when it's a $4,000 deductible and they're paying, still it's less than half of what the $9,000 would have been, even with the deductible. So let's just explore the why of health insurance a little bit more. Why do we need health insurance? And why is health insurance important? So what are your thoughts there? So Annetta said that even with health insurance, it still is expensive with that broken arm. You're right. It is expensive. And a lot of people don't realize that till they go have something happen and they end up in the hospital or something. So Michelle says it's better to have it and not need it than not have it at all, because you never know when you're going to need it. And Nicole shares that it sets the allowable for you to be charged, so you kind of can have an idea of how much you need to budget when you know how much you're going to be charged for things. So Kia says that she can't hear. Is anyone else having problems hearing? Okay. So Kia, it maybe it is your connection. If you want to go leave and then come back, I'll admit you again. Maybe it was just a bad connection that we have, or if you can hear some, I'll try to speak up a little bit more. Or yeah, Jesse's suggestion is to call in with the phone. We have a phone number there you can call as well. So, okay. Okay, so let's talk a little bit more about why we need health insurance. So as most of you probably know, we have a health insurance law now that emphasizes the importance of having health insurance. And just by coming to the session today, it shows that you know the importance of having health insurance. And there are many reasons why having health insurance is important. One reason is it's a way to manage those potential risks. In this case, the risk of becoming injured, or it could be the risk of getting sick or developing a chronic health condition such as diabetes, and the risk of needing to pay a lot of money for health care. When a health problem happens, the results can be very costly. And health insurance helps to reduce that risk, especially the financial one. So let's quickly review why we need health insurance. And as Jamie realized, having insurance protects us against the big things that we can't plan and prepare for. So good health is important, and there are many things that we can do to maintain good health. But sometimes we need medical care just to help keep us from getting sick or help us get better when we are sick or injured. Medical care can be expensive, so having that health insurance can help us get and pay for the care that we need. If you have health insurance coverage, this decreases those out-of-pocket medical expenses. And so having health insurance may provide you peace of mind, both for you and your family. Having health insurance also helps to protect your family's financial future. In 2013, over 20% of American adults were struggling to pay their medical bills. That means out of every 100 adults, 20 adults have problems paying for care. Sometimes families go into bankruptcy because they can't pay all their bills. Again, in 2013, 3 in 5 bankruptcies were due to medical bills. Recent research also shows that medical bills can completely overwhelm a family when an illness or injury strikes, and that millions of people don't take their medications because they cost too much. And not taking medicine is a way that they feel that they can control their medical costs, but not realizing how they're putting their health at risk when they don't take their medicine. Health insurance helps to pay those costs when you need care and protects you from very high medical expenses. You may not think that you need health insurance right now, but you could be like Jamie and have an accident that costs a lot of money. So health insurance really is a way that you can help manage that risk, that chance of that an accident or illness will happen to you or someone in your family. Now, with insurance, you have to pay in advance with a monthly premium. So you can't sign up for insurance once you get sick or hurt. It's just the same as automobile insurance. You don't sign up for automobile insurance after you've had your car accident. So the goal is to have coverage in place well before you need it. And certainly health insurance helps to prevent those large, unexpected healthcare expenses. Many health insurance plans also offer services and programs to help keep you healthy, those preventative programs. If you take advantage of these services and programs, you're likely really to save money over time. So some of the things that are included in those health and wellness services and programs are annual wellness visits. Some plans offer benefits like personal wellness coaching or healthy pregnancy programs. Some offer gym membership discounts or nutrition counseling, and some offer online seminars or webinars, checklists, tools, and calculators. So it's becoming more of the trend now for health insurance plans to offer these type of preventative services. And having health insurance can lead to better health outcomes. If you and your family have adequate insurance coverage based on what your healthcare needs are and your wants, and you use your insurance as it is intended to be used for prevention visits, immunizations, and the like, you will likely have better overall health. And if illness like the flu or measles is prevented, you aren't out of the cost of care, as well as you will not miss work or your children will not miss school. So you'll just have a better health in general if you have insurance and you use it to the most that you can use it.
All right. So I am going to take over from Lisa here, and I'm going to direct us back to the chart that we were just looking at before. So we've talked a little bit now about, why health insurance is so important, and, why we would want to make sure as a family that we have health insurance coverage. And part of that discussion kind of leads us back to this broken arm chart, right? Because one of the questions that comes up is, okay, I need health insurance. It's important, but how do I make sure that I have the right health insurance plan, both for me, for the people in my family, for those who maybe you are involved in health insurance decisions for other people in your life. And so part of that leads us back to this. Now, Jesse just put a link in the chat to this chart. I know the text here is really small. So if you would like to pull up that link, it's a link to a PDF copy of this, and you should be able to pull it up and blow it up bigger so that you can read it easier. I'm also going to go through some slides here, and it's going to make this chart go away, but I'm going to ask you some questions about it. So if you have a way to keep it pulled up, maybe in another window or something like that, that would be really, really great. Again, if you have any issues with it, just let us know in the chat. Otherwise, I'm going to assume that you can see what I'm talking about here. And Jesse says this chart was also sent to you in the email with the documents. So if you have that email pulled up and that's easier for you, go with that. If you're not in a situation, if you're on the phone listening to us, or if you're not in a situation where you can pull this up, that's okay. I'm going to try and go through it both out loud as we go through this here, so that if you don't have it pulled up in a separate window, that shouldn't be a big deal. Okay, so this chart shows us the cost of a broken arm without insurance. That's that first column that's in white. And that was what Lisa told us about a little bit earlier, that totals almost $9,400. And then it gives us three other situations. The first one, so it says Plan 1, Plan 2, and Plan 3. Plan 1's in blue, Plan 2 is in pink, and Plan 3 is in green, okay? And then it gives you a little bit of information about each of those plans, and it gives you the total cost, how much you would pay for the broken arm in each of these different plan situations. And what we're going to talk about as we go through the rest of this is, if this were your decision, if you were deciding between plans on the marketplace, or if you're starting a new job, or if you're in open enrollment and you're trying to make a decision between different plans, how do you make that decision? What are the factors that you take into consideration? How can you find the information? All that kind of stuff. So that's what we're going to talk about from here. I'm going to ask you to give me a little, so take a good look at this chart, take a good look at the information that it's showing us, and see if you can come up with anything that you notice about it. Differences between the plans. The first row has premium amounts, and it gives you both how much you pay per month and then how much that person is paying over the course of a year for that plan. And I should also say that this is for one person. So this is that in that blue column, it says $84.43 monthly. That's for one person to have that bronze HMO plan. Okay, so looking at this chart, what do you notice? And it could be something as simple as like, there's a lot of information here. Nicole says higher deductible, lower yearly cost. Yes, we're going to talk about that a little bit more. That's a really, really great observation. Anybody notice anything about, I know when I saw this for the first time, I was like, man, that is a lot of words that I'm not sure if I know what they mean. When we're looking at these kind of cost breakdowns when it comes to health insurance, that can be something that really strikes people, especially when you're kind of looking at it all for the first time. We're going to talk about that a little bit more. All right. Last chance. Anyone want to share anything else that they noticed about the chart? We're going to come back to it in a little bit and ask some more questions. So if you don't have anything right this second, don't stress. All right. If I hear from anybody in the chat, I will let you know as we move along. So I mentioned this a little bit, but when we talk about health insurance, and when our team that teaches this health insurance stuff, when we were originally looking into this information, one of the biggest pieces of feedback that we got was, health insurance is really confusing. And part of the reason that it's so confusing is because it kind of has its own whole language. There are all of these words that only apply to health insurance, titles of different plans. People always talk about alphabet soup, right? And that comes up with health insurance a lot. There are all sorts of acronyms and terms and words that it can be really challenging to read for the first time and figure out what in the world they're talking about. So we're going to do a little activity here first. I'm going to put up a poll. Hopefully it's going to launch for me. We'll see. Sometimes I have luck with the polls. Sometimes they like to mess with me. So I'm going to launch a poll for you guys, and we're going to do a little activity to see how well we know some of the common terms that are associated with health insurance. So in the poll, you're going to see a definition, and then it's going to give you a few examples, and I'm going to ask you guys to pick the one that you think is the right term to go with the definition. Your name won't be attached to it. It's not a quiz. It's not a test. It's just for us to get a little bit of practice with the terms. So here we go. Theoretically, you are seeing the first question that we have here. If you're not seeing it, let me know in the chat. Sometimes I have to end the polling and restart it for everyone to be able to see it. Oh, at least one person can see it. I got a response. So hopefully you're seeing it. Says number one, a set amount, for example, $20, you pay for a covered service. You pay this amount when you get the service, and it can change based on the type of service. You may have to meet your deductible first. Okay, so it's a set amount you pay for a covered service. You pay this amount when you get the service, and it can change based on the type of service. I'm going to give folks just a little bit more time to respond. Almost everyone has given us an answer here. Well, and I should say our options here for what you could pick as your answer are coinsurance, copay, fixed healthcare expense, or deductible. And I will give everybody just another 30 seconds, and then I'm going to close the poll and hopefully show you guys what we put as our answers if I can figure out how to make that happen. All right, about to close the poll. So just about everybody said that it was copay, which is correct. So when we're talking about that set amount, for example, $20, that's a copay. Co-insurance is very similar, but that amount changes. It's usually a percentage that we pay based on the service. So they're really, really similar, copay and co-insurance. And fixed healthcare expense is kind of similar too. Okay, so I'm gonna launch a different question here. So for our second question, it says, the amount you owe for healthcare services, your health insurance or plan covers before your health insurance or plan begins to pay. All right, so that's a little bit confusing, but the amount of money that you've got to pay before your health insurance is going to start paying for anything. So it's that portion that you're responsible for before they're kicking anything in. And then our options here are deductible, copay, co-insurance, and premium. And we've got responses from just about everybody. I'm going to close it out in just a few seconds. All right, so you guys did really, really well with this one. Deductible, that's exactly right. And I always remember this one because it's the same thing as car insurance, right? So at least sometimes they keep the language consistent for us. So deductible, that's that amount that you've got to pay before they start paying anything. And like Nicole mentioned, when you've got a really high deductible, you don't have to pay as much in premiums, partially because your health insurance plan is like, well, you're going to pay quite a bit before we have to pay anything. So you don't have to pay as much every month. And if that deductible goes down, then usually those premiums go up. We'll come back and look at that a little bit more. All right. We only have two more. I promise I won't make you do this forever. Okay, so this one says a letter from an insurance company showing what treatments and or services were paid for. It includes the service performed, the provider's name, the patient's name, the fee, how much the insurer allows, and then how much the patient must pay. And I think that first one is actually supposed to say evidence of coverage. It says evidence of, but my guess is that that's supposed to be evidence of coverage. So our examples here, our answers here, are evidence of coverage, medical bill, explanation of benefits, and proof of insurance. All right, got responses from just about everybody. You guys are doing an excellent job. So once again, you guys got 100% explanation of benefits. So it's in a way, it's kind of self-explanatory. It's a letter that they send you explaining the benefit that they provided. And it's really, really important documentation because if you need to, for some reason, say, hey, I think you charged me wrong, these documents can be really important to help you figure that out. So explanation of benefits, those are really important documents. All right, and our final question. This says groups of healthcare providers and facilities that your health insurer or plan has contracts with to provide healthcare services. Anyone who's part of the group is considered a preferred provider, okay? So it's a group of folks that we're calling preferred providers. Man, they're not making it easy on me to say these things. And your health insurance company's got contracts with them for specific services. And we've got responses from just about everybody here. We'll give our last few folks just a few more seconds. All right. So once again, you guys did an excellent job. That is a network, and we're going to talk a little bit about that, making sure that we understand how a network works for our insurance plan. So in network is something that we hear people talk about all the time, the importance of staying in network. And that's usually because when we have our preferred provider network, it's less expensive for us to stay in that network to get care. There are also situations where your health insurance plan is not going to cover anything outside of the network. So if you go to a provider outside of the network, there is a chance, depending on the type of health insurance plan, that they will say, nope, you went outside the network, so we don't have to pay for that. And we're going to talk about that a little bit more later on. Okay, so thank you guys for participating in that. Hopefully that was at least a little bit fun, a little quiz to talk about some of these things. But my hope is that it helped you see that those terminology things that go along with health insurance are really, really important. And we've got another awesome link from Jesse in the chat for our important words to know document. So our team went through a bunch of the most common health insurance terms. And what we tried to do was take those terms and reword, rephrase the definition so that they are more understandable for folks. Okay, so we tried to keep them much more easy to read, a little bit shorter, and hopefully they're going to make more sense because terminology when it comes to health insurance is just so extremely important. Okay, so important words to know. You should have gotten it in the email when you were sent all of that stuff, but there's also a link to it in the chat. And I will say I love that document. When I signed up for my first health insurance plan, I used it all the time when I was trying to understand what they were offering me. It's really, really great information. So back to the chart. Part of the reason that we talk about these important words to know and all of this stuff when we're looking at this chart is because even just in looking at this cost breakdown, you can see premium, deductible, those percentages that are listed there are coinsurance amounts. You can see out-of-pocket maximum down at the bottom. You can see copay listed there, specialist, hospitalization. These are all health insurance terms that it can be really important to know to make sure that you're understanding how your health insurance plan works, okay? And so understanding terms is often kind of the first step when it comes to feeling comfortable with a health insurance decision that we make. We're going to talk more about some of the terms as we go through. We're going to give you some tools that you can use to kind of break down how these different things apply to you. I didn't go too much into the difference between the HMO, POS, and PPO, but we're going to talk about that a little bit more when we give you guys a tool that we use to help people make health insurance decisions. All right. So continuing on, when we're looking at that chart, if you guys could look at these 4 questions here and maybe put some answers in the chat, and I can go back to it in just a second if you need me to. So the 4 questions are, how do the charges compare across the plans? What factors contribute to the differences between the total plan costs? And what plan would you pick for Jamie? And then what's the value in having health insurance? All right, so starting with the first one, we already got some great information from Nicole who said that when we're looking at the charges across the plans, when there's a higher deductible, we can expect that there's a lower premium cost or yearly cost. And then the reverse is true as well. When there's a higher premium cost, there's usually a lower deductible to go along with it. Did anyone else notice any differences between the plans? I can go back to it. I know one of the things I notice when I look at it is the first plan, you're responsible for 30% after deductible, but for the pink and green plans, the silver and gold, it's only 20% after deductible. So that's an important piece. If you look at the out-of-pocket maximum too, when we're looking at that plan that's less expensive per month, there's more that we could potentially have to pay out of pocket. It goes up to a little above $6,000. Whereas with that green plan, the whole way to the right, the most that we would ever have to pay out of pocket is $3,750. Now, the reason that it has that total down at the bottom that's more than that maximum is because the maximum does not include the cost for the premium. So that maximum is just for what we call out-of-pocket costs. So those are things like copays and deductibles. They don't include premiums. All right, let's go back to our other question here. So what factors contribute to the differences in total plan costs? We talked about that a little bit. The differences in the out-of-pocket maximum, the coinsurance amounts, the deductible amount. So we can see that as it goes up. That the bronze plan, you pay the least out of pocket, but you're responsible kind of for the most amount. And then as you go to the right, you pay more out of pocket every month, but you're responsible for less of the cost later. Okay, here's a really big one. What plan would you pick for Jamie? Okay, so if you got to step into Jamie's shoes and pick a plan, you could magically go back in time and get Jamie health insurance before the broken arm, which plan would you pick? Let's go back to the chart here. And you can tell me the color of the plan, the title of it, however you want to refer to it. Michelle would pick the silver plan. Anybody else have any thoughts about that? If we look at the silver plan, the total cost is almost $4,000. Joyce also says silver for someone who is moving. Let's see, do we have anybody else? Anybody that would go with the gold plan? You know, there might be a situation where, so in this situation, the silver plan works out to be the least amount of money over the course of this whole experience. But if we look at the gold plan, a lot of what they're paying is in the monthly premium, right? And so if Jamie were to have more things go wrong over the course of the year, then they probably, it would work out better, right, to have that gold plan. But it's a little bit of a gamble because we talked about that Jamie's young and fairly healthy. So maybe Jamie expects that they're not likely to have a lot of other things that they need health insurance for over the course of the year. So there's never a perfect answer with these things. And there's a lot of different reasons. Nicole says a higher deductible plan. If they're otherwise healthy, it would be an emergency type plan. And they could meet the deductible like with the arm. Yeah, that's a really great point to make, that if you're someone who's young and healthy and you're really only expecting to use it when you have emergencies, maybe you would go with that higher deductible plan and then set aside money so that you have money saved to meet your deductible, maybe in an HSA or an FSA. So we have lots of different things that we would consider. So into this, we have money that we're considering, like what would fit into our budget every month, how much risk we are willing to tolerate, what our family situation is. I know for my husband and I, we're both pretty young and fairly healthy, but we also really like to travel. And so we usually go with a higher level plan because we like coverage for out of network in case we're away from home. So there are a ton of different things to consider here. We certainly don't have all the information in this chart, but I think an argument could be made for any of these plans, depending on what we know about Jamie. All right, so hopefully what we're getting from this is that the value in having health insurance is that no matter what plan you pick, it's at least providing you some level of protection. And the other great thing is that you're not locked into any health insurance plan that you pick for life, right? You can pick one and then you get to open enrollment and realize, man, this didn't work out super well, and then you can make a change. So the value in having health insurance really is that protection factor, keeping you healthy, a lot of the things that Lisa talked about before. And speaking of Lisa, I am going to turn things over to her here.
Thanks, Carrie. Okay, so now that we have a better understanding of all the terminology and why it's important, we're going to look at the what. So the what of health insurance is really, what do I need to know and find out? And what do I need to compare and consider when I'm making my health insurance decision and make sure that I'm making a good choice? So we have questions that you may have that we can answer here, but once you start working on this on your own, you may have other questions that we did not cover. So it's really important that you have some resources, that you know where to get that information that you need when you're trying to make that decision. And it's best to kind of think ahead of time. Like, most people know when their open enrollment is going to happen. So maybe trying to collect and do some of these things ahead of the time of when that open enrollment period opens. So it's important to consider what you need to know, and to find out and compare and consider. So some people compare and they choose health insurances based on the cost of the premium alone. But as Carrie pointed out in the previous example, that it's also important to consider the coverage that you're getting and what best meets what your health needs are and your financial needs as well. So the premium does not make or break the decision, if there's other things to be looking at as well. So we have a booklet called the Health Insurance Workbook that we have put together, and it really helps you to organize the information that you need to make those decisions and be prepared when you're making that decision of what plan to get when you have open enrollment through the marketplace or through your employer. So I'm sure that Jesse's putting up a link to that. Oh, are medical deductions ever factored into annual selections? So Joyce, you're asking, so when you're making that selection of, you want to look at how much your deductible is that what you're asking about? I'm not sure if I'm, I know. No. I'll keep an eye out for your response on that. But so you also were sent a copy of this workbook. And I also want to let you know that it is available on our website, and the link is at the site is at the end of our presentation. And it's actually a fillable form that you can actually pull it up and fill it online. So it's really nice. You don't have to print it all out for yourself. So the My Smart Choice workbook starts, it has some key questions that are going to guide you through making that decision. And on page 3, we're going to start with that. When you're doing this at home, it might be helpful to have some like Post-it notes or something that you can tab some important places and maybe make any notes or suggestions as you're doing these worksheets, or something you have to look up and you put a little tab there that you have to go back to and fill that in. We talked about those important words to know, and you'll see these again because on each page, as we're talking about specific words, we actually put the little definition there to remind you what that means. For example, do we have a primary care provider? And we talk about what is a primary care provider. So you'll have those to the right of each page that will help you to understand the words if you forget what that meant. So as you get organized, some things to get together before you start working on this is get that monthly explanation of benefits that we talked about earlier, that you get, is sent from your insurance company whenever you use any of the healthcare services. Also, a statement or record of your prescriptions that you've gotten over the whole year, not only for yourself, from anyone who is on your plan. Your credit card or bank statement or check register, however you pay for your healthcare expenses. So you have a record of how much you paid out of pocket for healthcare services in the past year. And then a calendar to look at the frequency of how often you and your family members had doctor's appointments. So you may wonder, why are we looking at last year's thing? But when the worksheet, the needs worksheet starts on page 6, and it really helps to inventory what health insurance services that you used in the past year, because often we may use the same services or very similar each year. And so it's a good idea to use last year as an example, um, because you probably go to the doctor the same amount of time, get the same prescriptions. But if you have something that's changing in the next year, you want to be thinking about that. Perhaps maybe a pregnancy, having a new baby that may be coming in the next year. So you want to make sure your health plan is giving you the best benefits for those as well. So looking through the worksheet, you're going to find 5 sections. And each one of those, I'm just going to go over briefly. Section 1 talks about your family doctors. Section 2 will organize your prescription drugs. Section 3 will ask you to reflect on any changes to you or your family's health situation, as I just mentioned, or it could be if you're planning to have like a knee replacement surgery next year or something like that. Section 4 is really to help you figure out what is most important for you in a healthcare plan. And then Section 5 summarizes what type of care that you need. So that will really take a while to go through all of those. So you want to have some time set aside to work on those. Okay. So, Joyce, I'm going to save your question for in a few moments. I'll answer that. Okay. So then on page 13, we look at the plans that we may be available to us, and we might want to select 3 plans to start with and compare them like we did with that chart before that we showed the bronze, the gold, and the silver plan. You want to compare different health insurance plans with what your needs are to help to organize that and see, kind of do some comparison shopping. We mentioned before that a lot of people just make those choices based on premium costs alone, but there's so many other factors that are important, including what types of services are covered, what's the maximum out-of-pocket limit. You need to check to see if the doctors that you use are in the network that you're looking at with your health insurance plan. So it really helps you to compare like up to 3 plans when you're thinking about that and filling all of that information in. So if you look at that, on the left-hand side, there's important factors to consider, the different types of plans. Then the 3 columns in the middle are you can have 3 different choices that you're looking at. And one benefit is that with the Affordable Care Act, all of these plans have to have standardized information in language that you can understand. So you want that summary of benefits and coverage document because that tells you what's covered in that plan that you're looking to purchase for next year. So there's 2 places that you can get that summary of benefits and coverage. You may get it through your employer or through your health insurance marketplace, or you can contact the health insurance company itself, or you may have to talk to the doctor's office to determine the answers to some of these questions. So you're going to have to do a little bit of research when you're filling this out. So Section 1 provides a way to organize some basic information about the plan, whether there's out-of-pocket limits, if your doctors are in network. And then Section 2 is a place to organize the coverage information as what's covered, what are the out-of-pocket maximums, and whether you will have coverage when you travel out of network, which is kind of what Carrie was referring to. If you're traveling, can you get services somewhere else that may not be in network? Section 3 covers grandfathered health plans, and Section 4 through 6 helps you to calculate those out-of-pocket costs for different health services based on last year's visits to the doctor and other organizations. So you will review the costs for prescriptions, for vision, and for dental. And then finally on Section 7, you have a summary of all of those costs from the previous pages, so you could determine what your total annual out-of-pocket costs will be for your health insurance for that particular plan. And you can also calculate the total monthly cost. So that's going to be helpful when you go to the last part of the workbook, which is my monthly spending plan. And this is found on pages 21 and 22. You actually create a spending plan that will include required and extra expenses. And it has a place there. So if you get that health insurance tax credit each month, if you're eligible for that, to reduce your monthly premium cost, you actually include that in there in that worksheet. And the worksheet has you organizing your income and your expenses. So you really can determine how much you can afford to spend on all expense categories, including health insurance and healthcare. So this really helps you to know which health insurance plan is going to fit best into your budget. Now, we know the largest expenses in families' budgets are housing, food, and transportation. So as you work through the spending plan, remember the recommended guidelines. 70% of your monthly income for living expenses, 20% for paying off debt, and 10% for savings. So after you've reviewed your available health insurance plans, you can now begin to total your healthcare out-of-pocket costs. Some of the other documents that you received were some fact sheets that we've created with our team here at University of Maryland and University of Delaware. One is on flexible spending accounts, FSAs, and health savings accounts, explaining what those types of accounts are. And also another one just on flexible spending accounts. So those are also available on our website if you need it or want to share it with somebody else. So all right. Okay. Okay, Carrie, I'm going to let you take over. And Jesse, if you want to look at that question, Jesse's more the finance person than me. So I'm going to see if he can answer that question for you, Joyce, and look at that while Carrie's finishing doing her section.
All right. Thanks, Lisa.
Mhm.
So just to kind of recap, we talked a little bit about why health insurance is important, why we need health insurance. We talked about what we need, what information we need to get or find out, and what we need to compare or consider. And that was in that section that Lisa just covered for you guys. And really, I can't stress enough, that book is so, so very helpful. It really takes you through kind of step by step how you can make a decision between different healthcare plans that you might be offered. So it's really a huge help. I can't recommend it enough. And it really helps you make that smart choice decision. Okay. We also have some resources that we're going to share with you all. I know we're getting close to our time here and I am almost finished, I promise. Jesse's putting some things in the chat. The first is our team's health insurance website. You can check that out. We have some really great tools that are listed there, some things about, estimating your costs and different things along those lines. We also have the healthcare.gov website here, especially for those of you who were talking about coming from states that are not Maryland. Going to the healthcare.gov website is where you can get connected to the nationwide health insurance marketplace. If your state has its own exchange, then that website will direct you to it from there. So that's a really excellent starting point. The next one is a document that Consumers Union put together, and it's really excellent, just with some basic information about healthcare. And then the final one is some information from the IRS, and they cover some great things about health insurance too. Okay, so again, just a reminder that healthcare.gov is really, really wonderful. And if you go there, you can get some more information if you need it. I'm going to ask you guys now to go back to that form that we had asked you to fill out before. If you still have it open, that would be great. There was a point, I think, where it asked you to stop, and then you can kind of go back and start with the questions that say at the end of this workshop. And again, it just gives us some really great information about how we're doing overall with the program. I'm going to take just a couple seconds here to read a comment from Nicole. Yeah, she's talking about one size does not fit all with insurance, and it's really, really important to know what you're paying for. Especially, she's talking about for low income families paying high premiums and high deductibles. Depending on your state, if you go through the health insurance marketplace, you might be able to get assistance, get some help with paying for your insurance, sign up through some of the other plans that are options for different folks. But definitely, health insurance can be so very expensive, and it's really important. Sometimes I make the analogy of, you pay that monthly fee. It's kind of like being a member of an organization, and as a member, you want to know what you should get in return. You want to know what kind of services you should have access to. And our document, that workbook that we gave you guys, really is a great starting point for figuring out, are you in a situation where maybe it's better to pay for a lower premium plan because you're not utilizing insurance very much? Or do you have some chronic health conditions that maybe make your healthcare expenses more expensive over the course of a year? So although you'd pay higher premiums for some different types of plans, maybe that makes more sense for you and for your family because you actually would get that money back over the course of the year. So thank you so much for that comment, Nicole. I think that's a lot of really great information there. All right. So that brings us to the end of things today. If you need more information, if you are looking for more training, maybe for your workplace or for an organization that you're part of, you can absolutely reach out to our team here. My contact information is there, and so is Lisa's. If you go to our website, there's a contact us link as well. So we're around. If you need us or if you need more specific questions, we're happy to answer them for you all. And